Hey everybody, Luke Gordon here, and I'm back with another video about knee pain. And in this video, we're going to talk about how to treat patello-femoral joint pain, which is the most common cause of knee pain. So if you're looking for ways to treat your knee and get rid of pain and get back to your activity level, this video is I'm going to walk you through all of those steps. So to do that, I'm going to use my fun little sheet here, the 3 phases of recovery. I kind of usually call it the 3 phases of healing as well. And so when I'm explaining how to treat knee pain, we're going to walk through these 3 phases. Now, first phase is pain reduction. So if you have knee pain, the first thing you want to do before you ever try to advance your exercises and really hit strengthening hardcore is you want to get rid of as much pain as you can. So let's say you do have patello-femoral joint pain, which I just made a video about, and you've got pain along the front of your knee and your kneecap. And what you want to do again is you're trying to get rid of all of these causes of pain, which can include things like weakness in your quads, weakness in your hips, poor alignment in your feet, IT band issues, underlying issues with arthritis. So we want to treat all those things. But again, step 1 is let's just get the pain level down. So how do we get your pain level down? The first thing we want to do is we want to, if there's any soft tissue pain around your knee, IT band, your quad muscle, we want to start to massage that tissue and get rid of as much soft tissue pain as you can. So if you have this type of knee pain, just kind of poke around down there, poke into your quad, which is the muscle leading up to the top of your kneecap, poke along the side of your thigh into your IT band. And if there's any soft tissue just irritation, just be aware of that. We want to start treating that pain as much as we can. That's one thing you can do. I'm going to give you 3 things in this phase. The second thing is you can start to mobilize your kneecap. Now, in the first video about what causes patello-femoral joint pain, I talked to you about how your kneecap doesn't like to track towards the outside of the joint, but it often does that. Now, over time, if you've had knee pain for a while, what can happen is your kneecap can also get really tight, so you can't really move it as well. You should be able to, by the way, just sitting, if you have your knee comfortably out in front of you and it's straight and it's relaxed, you should be able to grab your kneecap and just wiggle it side to side, let's say about 1/4 inch or so. But it shouldn't be like glued down. But if you have had pain for a while, it might be really tight. So what you can start to do to decrease your pain is take your kneecap along the outside of it and just start to gently push it towards the inside. So again, have your knee out straight in front of you, comfortably straight, relaxed quad muscle, all that, and just start to mobilize gently your kneecap towards the inside of the groove. Because ultimately, to give you pain relief, we want that kneecap to track correctly. As it's moving up and down in the groove that it sits in the femur, we want it to track more towards the inside and less towards the outside. So again, we're in the early stages here. Soft tissue massage to get the pain level down. Start mobilizing your kneecap towards the inside, so towards your midline, depending on which knee you're working on. I'm kind of showing you like with a right knee, but we'll see how that works. So those are 2 things in the early phase. The third thing too that I really like in the early phase is you can use taping techniques. I like to use kinesio tape or rock tape, the flexible tape now because it's really easy to apply. You can also use more rigid tape like McConnell tape. I've got a really old video with me doing McConnell tape. I should link it here, way back in the day when I've got short hair, no beard, all that stuff. I think it's the second video I ever made in my whole life. So anyways, I'll link that here just for fun. But that's a really good taping technique. And the idea with taping is that you're not trying to get reliant on taping so that you always have to tape your knee to feel good. But in the early phases of your recovery, you want to get that pain level down so you can tolerate more exercise. And you're not at the point yet where you've really trained your muscles to help you with your kneecap alignment, where you want it tracking more towards the inside. Your muscles will ultimately do that for you. But early on, taping is a really good way to go to help you with that alignment and that tracking. So again, check that video out if you want to. It should be a fun one. So that's phase 1. So again, we're in phase 1. That's the red phase. We're just looking at getting your pain level down. Phase 2 now, as you're starting to feel a little bit better and you feel like you can tolerate more exercise, now I want to get more into strengthening. So I've got a video called the top 5 exercises I think it's called for patello-femoral joint pain, something along those lines. I'll link that here and at the end. And so I'll link that video up here for you. I think I can link more than one in one video. But that one, so we're going to get into strengthening your quad muscles and strengthening your hip muscles. It's equally important to strengthen your quad muscles and your hip muscles. Now, directly when you strengthen your quad, it's going to help you with that kneecap alignment because your quad muscles engulf the kneecap. So if they're nice and strong, they can start to pull that kneecap towards the midline again, which is what you want. So quad strengthening is super important. So we're talking about exercises like small squats, straight leg raises, things like that. Again, I'll put those in the video so I don't have to explain them all right now. But you want to start strengthening your quads and your hips. So hips would be like side leg, laying on your side, doing a side leg raise, clamshells, things like that. So early strengthening in phase 2 is just to strengthen all those muscles up so that you're improving the alignment of your knee and the kneecap. Also in this phase, maybe even back into phase 1, is that if you have a foot where your arch collapses and your foot and ankle are collapsing towards the midline, that's also having a negative effect on your knee. So supporting your feet at some point early on is a great idea, whether that's like an over-the-counter orthotic, a better pair of shoes, a custom orthotic. Either way, if you look at your feet and say, my feet are collapsing inwards, that's going to be a potential underlying cause of your knee pain. So we want to correct your feet as well. So that's in phase 2. We're building up strength. And then finally in phase 3, what we really want to do is advance to more functional strengthening. And when I say that, we're getting into like deeper squats. We're getting into like reverse lunges, things like that. Because again, if your goal ultimately is to be able to do like deep squats, up and down stairs, up and down from the ground, maybe you want to do running, hiking, pickleball, golf, whatever you like to do, some other type of sport, you need more strength than just the average level of strength. So I'll link that at the very end of this video. I've got some great exercises on once you've advanced past your pain and past those introductory exercises, which were the top 5 exercises. I'll give you even more for more like moderate level strengthening where now you can really start to push it. So that's how you treat knee pain, especially this most common cause that we call patello-femoral joint pain, which is your kneecap just not tracking great in its groove. So I hope you picked up some good pointers there on how to decrease your pain, increase your strength, get back to full activity, which is what it's all about. So I'll link some videos at the end here to help you out with that. I'd appreciate a comment, like, and subscribe before you go. Love to hear from you guys. So I hope it helped, and thank you for watching.